Okay, let's gather the important points on JVP for exam purpose in the part 1 and part 2 MRCP theory examination. Now, JVP is basically the pressure in the right atrium, which is observed through the right internal jugular vein. Basically, it's not palpable, and you will see a wave like pattern, two pulses per heartbeat, and that is how you will differentiate from the carotid pulse. The carotid pulse will be palpable. Right internal jugular vein will be basically under the sternocleidomastoid. So, what you will see is basically a wave pattern over the sternocleidomastoid. Anyways, if it is more than 3 centimeter, then it is supposed to be called as raised JVP. If there's no pulse in the JVP, then that might be due to superior vena cava syndrome. If the JVP is raised, you will have only 4 differential diagnoses in your mind, that is heart failure, fluid overload, constrictive pericarditis, and cardiac tamponade. In constrictive pericarditis, you will see something called as a Kussmaul signs, in which the JVP increases during inspiration. So, JVP is on the right side, so it will be concerned with the right valvular diseases, or if there is some constriction or relaxation of the right atrium. So, all the left sided pathology like mitral stenosis and aortic stenosis and those regurgitations are completely out of your context when JVP is increased or there is some problem with the waves. So, just focus on the right side of the heart if the JVP or the waves are abnormal. So, that cuts off half of your options in the paper. So that is one point. Now you will have all waves and two descents. So there is X and Y descent. That is whenever the pressure in the right atrium is decreased. So you have to see when will the pressure decreased. When the right ventricle is contracting, so the right atria is relaxed. And second is when the tricuspid valve is open. So Y descent is when the opening of the tricuspid valve, and X descent is fall in the right atrial pressure during the ventricle systole. Basically, it's the atrial expansion. The right ventricle is making some space for the atria to expand. Uh, so that is X descent. Now X and Y descent are two continuous processes which are always happening. So X is actually divided starts from after A, and it has got two parts, X1 and X2, or X dash, and then the Y descent is happening, and these bumps are just events which are occurring momentarily. So it normal the whole scenario is decrease in the pressure, and these are just some episodes or moments when the pressure increases. So A wave is basically right atrial contraction. There's increase in the right atrial pressure, and that will cause large A waves. So whenever there's right ventricular hypertrophy, the right atrial pressure will rise more than what it's normally. So in cases of tricuspid stenosis or pulmonary stenosis or pulmonary hypertension, you will see large A waves. If the atrial fibrillation is there, where the atrial pressure is not increasing, so you will not have an A wave. So there will be absent A wave, which is obvious. If the atria is contracting against a closed tricuspid, you will have Cannon A waves, and stiff closed tricuspid can occur in complete heart block, where there's complete disarray of the synchronization between atria and ventricles, in ventricular tachycardia or ventricle ectopics, in nodal rhythms, in single chamber ventricular pacing. So this is important, especially complete heart block. C wave is due to the bulging of the tricuspid valve when the right ventricle is contracting. Normally, it is not visible. V wave is due to the passive filling of the atria against the closed tricuspid valve from the SVC and IVC. When will you see giant V waves? When there will be tricuspid regurgitation, and there is very much likely due to Ebstein's anomaly in the examination. Now, whenever you see giant V waves, make sure that there will also be loss of X descent, because the pressure in the A wave does not fall in this case. So that is all for JVP. Hope this helps in your exam. Thanks for watching. Do subscribe to my channel.